Pulmonary rehabilitation programs are interventions that are meant to improve the quality of life and day-to-day activities for people that have chronic lung disease. Pulmonary rehabilitation programs are typically found in hospitals, in their outpatient clinics, but you may also find them in community centers and health units in your area. So what are they? They're run by healthcare professionals. Often a physician is the director. Physiotherapists, respiratory therapists, nurses are all involved. People that have a chronic lung disease are referred by their doctor, and they come to a pulmonary rehab program for exercise and education. So the exercise part is a key part of pulmonary rehabilitation, and I know it can sound a bit intimidating for someone that has a chronic lung disease, but it's actually the number one thing that people can do to be able to maintain independence and quality of life. So the exercises are really geared towards the individual. People in the pulmonary rehabilitation program are all exercising at their own level. They get an exercise test when they start. The exercise prescription is really geared to them specifically. They work at their own pace, and they're supervised and guided throughout the whole program. Another key part of pulmonary rehabilitation is the education. It's really important when you're handling a chronic lung disease such as pulmonary fibrosis to really have a good understanding about what the condition is, how to manage flare-ups, what the different medicines do, how to handle energy conservation issues. And so the pulmonary rehabilitation program helps provide that information so that you're able and feel more confident in managing your chronic condition at home. These programs typically run for about 6 to 8 weeks. And as I mentioned, they're often in outpatient departments of hospitals, but you may find a pulmonary rehab program in your own community that is in a YMCA, or a community center, or sometimes the health units have the programs there. So they're really found in a variety of different places, but they're all similar in that they're run by a healthcare professional who has expertise in working with people that have chronic lung disease. So participants of the program come 2 to 3 times a week, usually for about 2 hours. So some portion of that is the exercise, and some portion of that is the education. And a key part of the pulmonary rehabilitation program is that it's done in a group. So it's not just you by yourself. You have the opportunity to meet and interact with other people that have chronic lung diseases, such as chronic obstructive pulmonary disease or pulmonary fibrosis. And that ability to interact with other people and gain some knowledge just from sharing your experience and them sharing their experiences is really a key part of the support that you get from a pulmonary rehab program.